Let me invite you, our Director of National Cancer Institute, Professor Jarmalaitė, to talk, to say welcome speech and to talk about ABU EU Certified Host Center for Prostate Cancer.
Good morning, everyone. It's a great pleasure to start this annual conference of National Cancer Institute as ABU Prostate Cancer Center. And let me shortly introduce our institute and our onco-urology department. So this year we have a first year of ongoing European cancer beating plan. And of course, Lithuania, as a part of Europe, also actively participates in these activities. Why Europe started this cancer beating plan? Because in the Europe lives around 10% of all world population, but we have 1/4 of cancer cases in the Europe. And actually numbers in Lithuania are also by percentage also similar. And Europe calculated, if we not take further action, actually the number of cancer cases will increase gradually, and around 2035 we will have more than 4 million cancer cases diagnosed yearly. So of course we needed a plan how to beat cancer, how to be more effective in cancer treatment, and Europe's cancer beating plan includes 3 main activities. It's prevention and early detection of cancer, diagnosis and treatment, and all these activities are meant to be done in improved level, in top level, and a big attention is taken to the quality of life of patients. But in this building of European cancer beating plan, we see also very important factors. First of all, the basement of all this plan is understanding of cancer. It's research activities in cancer area and implementation of the achievements in cancer studies. And of course, another very important event in this cancer beating plan is to achieve equal access of high top quality level procedures in the clinic. So equal access to top quality of cancer care and medicines. And with this, Europe plans to improve the life of more than 3 million people around Europe. In Lithuania, cancer control is organized in 6 clinics, and our National Cancer Institute is specialized clinics, while others are university level of cancer treatment facilities. Our National Cancer Prevention Control Program was prepared in 2014 and lasts till 2025 with the main goal to decrease cancer mortality rates by 2025. But yearly we still have quite high numbers, around 18,000 of new cases diagnosed with cancer, 8,000 of people dying from the cancer, and COVID period was truly an issue in cancer diagnosis and treatment, and we calculate that during this period around 5% of cancer cases remained undiagnosed and untreated. Comparing to European Union, we have quite short life expectancy at birth and quite poor level of avoided mortality rates. And regarding cancer, 5-year survival rates of patients with breast cancer, cervix, lung cancer, and some others are quite poor in our country, but we are quite proud to have a quite good level of 5-year survival with prostate cancer. Our National Cancer Institute Cancer Registry leader will present data more specifically. I only want to show you that the most frequent cancer for male in our country is prostate cancer and lung cancer, while in female is non-melanoma skin cancer and breast cancer. While we look at the mortality rates, the top level takes lung cancer, and in the second place remains prostate cancer for male. For females, the most mortal tumor in our country still remains breast cancer. So let me introduce our National Cancer Institute, which has quite long history, and this year we are celebrating 19th anniversary of our institute. All the period the institute was composed by 2 main components, a research unit and clinical department. And because of that, we can provide an offer for our patients top-level treatment and diagnostics. So our clinical departments are, as in every European cancer clinics, divided into diagnostics and treatment departments. And we have an emergency department and outpatient clinics. In outpatient clinics, quite large numbers of patients from all Lithuania are coming for the consultation. It's around 130,000 visits per year. And our diagnostic departments are composed of radiology department, endoscopic intervention group, and we also provide molecular diagnostics, including cancer biomarkers and genetic analysis. Our therapeutic departments are the main cornerstones of cancer treatment. So it's our medical oncology department, our radiotherapy department, and surgical departments are divided in our institute by localization, including our oncourology department. So my main numbers in our institute are around 200 clinicians, doctors working in our institute, while nursing personnel increase 300, and with some additional staff assistants, we have more than 500 of nursing professionals. And when we look at multidisciplinarity of our clinicians, we can calculate around 60 different specialities of clinicians. And as I already told, in our outpatient clinics, we have about 130,000 of visits per year. Radiology examination, it's also quite large numbers. It's 110,000 cases per year, around 18,000 surgeries, and thousands of visits into our medical oncology department and radiotherapy department. So National Cancer Institute is the only cancer center certified by European Oncology Institutes Association, and we already carry this accreditation for the second period and hope to achieve the top level of comprehensive cancer center in the future. In association with this European accreditation, we also have additional excellence centers localized in the departments. So we have ABU Host Center for Prostate Cancer in our oncourology department. We also have breast cancer competence center accredited by EUSOMA, and one EURACAN competence center for rare diseases. Our institute is active not only in cancer diagnostic and treatment, but also in cancer prevention. We participate and analyze cancer screening programs, prepare innovations in accordance with new cancer beating plan, and take a big care about cancer literacy of our population, and cancer education is provided for specialist clinicians, but also for public. So we have annual conferences for family doctors, also a lot of events organized for public, and we carry a patient school which annually attracts thousands of patients. Of course, we are involved in health policy, organize different activities, and we're involved in analysis of oncology service provision during COVID period, while trying to organize all these activities in better level if additional pandemic periods will happen. Our research unit is a separate building and organized in research departments, which includes Laboratory of Biomedical Physics, Laboratory of Cancer Epidemiology, Laboratory of Molecular Biology, Laboratory of Immunology and Genetic Diagnostics, and Clinical Oncology. Also, very important departments in research units are our biobank and cancer registry. So our research community is composed by 58 researchers, but in the clinics we also have a lot of PhD doctors, so the number in total of PhD doctors in our clinics is 62, but also we have 35 PhD students who are gonna become PhD doctors quite soon. Also have residency students, and all this team every year organizes around 50 projects annually and publish more than 70 top-level publications each year. And the number of clinical trials in our clinics is now around 70. With 1,200 patients involved in them. A little bit about our clinical trials. The number of early phase clinical trials increases every year, and the prevailing now phase is phase 2, phase 3 clinical trials. If we look at localization, clinical trials in urology and in prostate cancer, they are predominant. Also urinary tumors, lung cancer, breast cancer, all these localizations are covered by clinical trials, but they are not only commercial clinical trials, but a lot of biomedical studies initiated by our researchers. So total number of patients involved in clinical trials and biomedical studies mainly exceeds 2,000 of patients per year. We are proud to provide top-level genetic diagnostic for our cancer patients, which includes analysis for hereditary cancer. It's around 500 different screenings for suspected family cancer, but also we started to provide next-generation sequencing service, which increases number of detected family cases largely. Also, our genetic diagnostics department provide analysis of targeted mutation in order to provide personalized medicine a personalized treatment for our patient. And we have a bunch of different cancer biomarkers analyzed in the blood for follow-up of cancer patients. As I mentioned, one of our department is National Cancer Institute Biobank, which this period leads a huge project ongoing in our country, which is meant to build a national biobank which will unite biobanks from different clinics, including university clinics. And our National Institute Biobank already has more than 10,000 of different samples. It's of course cancer cases, but also some control samples, and we collect not only tissues, but also serum, plasma, urine, and other specimens quite important for further biomarker analysis. And our biobank, together with National Biobank, is a member of European huge structure, BBMRI ERIC. Also, our biobank is a part of different initiatives, including one of them devoted for prostate cancer analysis. It's a pioneer study, a European network for excellence for big data in prostate cancer research. Our cancer registry will be presented by the leader just after my talk. Let me simply tell that it's the only registry in our country, so it's a national registry, and it started its activity in 1957, so holds quite long history and provides annual reports on cancer statistics, and also provides numbers on our cancer data for European all registries, and participates in different analysis which follows cancer rates all around Europe. Our country, our institute is a part of not only OSCE structure as accredited cancer center, but also we participate in UICC, Union of International Cancer Control. We are an active member, as already mentioned, of BBMRI structure. In ORTC participate as a partner for clinical trials. Quite recently we joined Nordics network for cancer trials, so it's Nordic Net, and NSGO, Associated for Gynecology Oncology. And shortly our main achievements and projects which we are running up to date. So one of them is pro-cancer screening related to diagnostics of cancer with the help of MRI, and it's an European big project collecting 1 million of images for better prostate cancer diagnostics in the future. We are part of 1 million genome initiative, where we participate as a cancer center, and you probably already know this 1 million genomes initiative is growing into a big network, or a big European network for clinical genomics in order to improve personalized cancer treatment all over Europe. And a lot of different other research activities in EORTC, including SPECTRE study organized by EORTC, which provides molecular analysis for biomarker research and personalized treatment selection. So to conclude, our National Cancer Institute today is a huge building with a nice and educated society, providing top level of cancer diagnostics, treatment, and research. And 90 years we are here in Lithuania to help our patients. So a short introduction to our oncourology department activities, which is a BUEU certified host center for prostate cancer. And we are proud that this center is the first and only prostate competence center here in Baltic countries. Also one of the three BUEU host centers for urology in Europe and 1 out of 11 host centers for prostate cancer in Europe. Of course, accreditation to be a part of this European network, it wasn't simple. It was based on top-level clinical multidisciplinary work, top-level research, and good equipment and all wide range of diagnostic and treatment techniques available in clinics, which I guess will be presented during this meeting quite in details. So our oncourology department has 39 employees, including 9 PhD doctors and 7 PhD students. So it's truly a highly educated staff. And number of urology beds is 36. And annual number of patients is 1,600. And among them, the biggest number of patients are coming to our oncourology department with the diagnosis of prostate cancer. So as for diagnosis, we have truly a wide bunch of possibilities, and it's done as a systemic biopsy, also as a fusion biopsy. So the numbers of diagnostics are shown in the table. And previous year, we have diagnostic biopsies which exceeds 230. And as it's shown in the bars, every year we treat a lot of cancer patients, but the view a little bit changes due to active surveillance patients. So the main treatment still remains radical prostatectomy. Also radiotherapy is provided, but as you can see, number of active surveillance are increasing every year. So regarding prostate cancer treatment, it's quite hard to comment me here. I'm not a surgeon. So previously in 2020, we had 250 radical prostatectomies and 65 laparoscopic procedures for a radical prostatectomy, and each year the numbers increases. And actually this year we made an analysis of our clinical activities, and it's a COVID period, and for sure you know that the numbers of surgical activities in different clinical departments decreases. The same happened in our clinics, but surprisingly prostate cancer treatment remained at the same level or even increased during this pandemic period. Our oncourology department provides not only prostate cancer diagnostics and treatment, but also actively participate in education, in staff preparation, which means tutoring for residents, and of course actively participates in clinical trials and clinical research. The number of clinical trials this year is in total 21 clinical trials. Ongoing now is 6 clinical trials and 12 biomedical studies. The number of publications prepared by oncourology department staff is increasing every year, and previous year it was 12 publications, as in the previous year, 2020. And you can see the main clinical trials ongoing in the department. So clinicians of the department are also an experts in Lithuanian Bioethics Committee, Marius Kinčius, and the leaders of the department are also council members of Lithuanian Society of Urology. So to finalize, I will show main publications prepared by oncourology department through previous year. It's a great publications in innovative clinical trials, including Aramis clinical trial. But in addition, we are proud of our researchers and urologists initiated clinical trials, which includes immunophenotyping of prostate cancer and many other research innovations, which will soon reach our clinics. So let me thank for your attention. And of course, let me wish a good, fruitful conference. Thank you.